I welcome you on my channel Step 1 Insights. Let's start. A 4-year-old girl with type 1 diabetes mellitus is brought to the emergency department by her father because of a 4-hour episode of restlessness, sweating, and confusion that occurred during the night. Yesterday, he allowed her to eat cupcakes and cotton candy at a county fair. At her bedtime that evening, he increased her dose of subcutaneous intermediate-acting and long-acting insulin. Her symptoms began 6 hours later, then resolved spontaneously. After being informed this morning of this nighttime episode, the mother insisted the father bring the patient to the hospital. On arrival, the patient is alert. Her vital signs are within normal limits. Examination shows no abnormalities. Her fingerstick blood glucose concentration is 72 mg/dl. Urinalysis is negative for glucose and ketones. Which of the following is the most likely explanation for this patient's nighttime symptoms? The symptoms described for the 4-year-old girl with type 1 diabetes mellitus, restlessness, sweating, and confusion during the night, are characteristic of hypoglycemia. These symptoms, particularly when occurring at night, are commonly known as a hypoglycemic episode or insulin reaction. Given the history that her father increased her dose of subcutaneous intermediate-acting and long-acting insulin after she had consumed food with high sugar content like cupcakes and cotton candy, and considering the symptoms began 6 hours later, it is most likely that the symptoms were caused by D. Hypoglycemia caused by excess exogenous insulin. The high insulin dose in relation to the carbohydrates consumed would lead to a rapid decrease in blood glucose levels, resulting in hypoglycemia. The fact that her fingerstick blood glucose concentration was 72 mg/dl on arrival, which is on the lower end of the normal range and could have been lower during the night, and the absence of glucose and ketones in the urine support this conclusion. The other options listed do not fit the clinical scenario provided, as they would likely cause different symptoms or laboratory findings. For instance, hyperglycemia would typically result in high blood glucose levels and could include glucose and possibly ketones in the urine, neither of which is present in this case. Nightmare and sleep terror disorders would not cause sweating and confusion that resolve spontaneously and would not be associated with the changes in insulin dosing. Thank you for watching this video. Subscribe my channel, click like, and never give up.